Okay, so hi, my name's Eduardo Chavez. I am a professor of nursing at the University of Texas at Austin School of Nursing. And with me here today, I have a class of graduate nursing students. And in a minute here, I'll have them introduce themselves. But we also have two students, Lindsay and Kaylee, that will be presenting, giving us a presentation that I think you will enjoy and find very informative about COVID-19. Okay. If you want to go around the room and start introducing yourselves really quickly, and then we'll turn it over to Kayla and Lindsay. Okay,
Hi, I'm Fabia.
Hey, I'm Abby.
My name is Ryan.
I'm Lindsay.
I'm Gil.
Kayla.
I'm Christina.
I'm Alexandra. Both of the Alexandras.
Okay. Kayla and Lindsay, if you want to go ahead and get started, I'll hand it over to you now.
Okay, gonna pull up my screen really quick here. So Dr. Chavez, you have to allow us to share it because we're not the host.
Okay, let's see. Okay, can we try it now? See if it'll... There you go.
All right, so to get us started, like it was mentioned, Lindsay and I being Kayla, we're gonna go over COVID-19 and we will discuss some facts and myths and play a little game with that at the end, but we're gonna start with some introductions and just go over the basics of symptoms and prevention and all of that good stuff. All right, so just to lay out the objectives so you can expect, so you know the expectations of what we're gonna go over here. We are going to ensure that you understand the basics of COVID-19, know what can be done to help prevent developing and spreading the virus, know the common symptoms of COVID-19 and how those differ from the flu and cold since those do kind of overlap in terms of some of the symptoms. Understand what to do if you or someone you know are experiencing COVID-19 symptoms. Discuss the importance of keeping ourselves mentally healthy because sometimes change is scary and overwhelming. And so it's important for us to check in with ourselves and ensure that we stay mentally and physically healthy. And then know how to check the information you see online to be sure it is the most accurate and up-to-date information available because there's always information going around. So we want to ensure that what we're seeing and spreading is the most up-to-date and accurate. So to begin here, we'll go over just how COVID-19 got its name. So the CO is for corona, the VI is for virus, D is for disease, and 19 is because it originated in 2019. So some of us might not have heard of it until 2020, but it actually started in 2019. So a virus is essentially tiny particles that invade living cells or organisms, being us for this instance, to use them to replicate or reproduce like a factory. The coronaviruses are actually a family of viruses that are named for their shape. And most colds are actually caused by coronavirus, not COVID-19. So coronavirus actually existed before this. The COVID-19 is just a strand of coronavirus. So as mentioned, this is a strand of the coronavirus and it actually was identified in Wuhan, China in 2019. I think my computer's frozen. There we go. All right, so symptoms range from mild to severe, and younger people often do experience more of the milder symptoms, but it doesn't exclude them from experiencing more of the severe symptoms. And I don't tell you that to scare you, just so that you're aware that that is a possibility, and that just because you're young and maybe healthy, it doesn't exclude you from experiencing some of the more moderate or severe symptoms. COVID-19 is highly contagious. I'm sure we already know that, but just wanted to go over that. And that's why many US cities have enforced the stay-at-home orders to prevent unmanageable diseases or outbreak. And I just want to go over what unmanageable outbreak means. So think of it as like you're having a birthday party and you invite 14 of your friends and you want everybody to have birthday cake because everybody wants birthday cake, right? Well, you go to cut it and you only have 7 pieces. So think of that cake as our healthcare system. So you have hospitals and you have medical supplies, but we only have a limited amount of those. And you want everybody to have the cake or they're going to be sad. In the instance of the healthcare, if we have all these people getting infected and we only have so many hospitals and so many medical supplies to treat them, not everybody is going to get the care that they need. So that's why it's important for us to stay home. All right, and there's currently not a cure or vaccine for COVID-19. And we're learning new information about that every day. So as we learn more information, we're getting a step closer, but there's currently not anything for that. And I also just want to make mention that the research process that goes into making new medications or treatments or vaccines is a very lengthy process. And so it might be a little bit faster paced to help right now that we're looking for different treatments, but essentially from start to finish, whenever there are new medications, it takes 10 to 15 years for those to get on the market for people to use. All right, so going into prevention here. So it's very important to stay home. I'm sure you've heard that plenty of times already, but it's important that you don't go out unless absolutely necessary. And whenever you do go out for essentials, to avoid contact as much as possible with people outside of your household. So again, social and physical distancing, but it is important to still connect with your friends and people outside of your home, like maybe via Zoom, like we're using here, or FaceTime, because that personal connection is still really important for our mental health. And then when out for essentials, you want to stay roughly 6 feet away from others. So that's essentially the length of Chris Paul or Steph Curry. We prefer you be more LeBron, but at minimum, Steph Curry or Chris Paul. If you can, wear a mask or bandana whenever you're out in public. We'll give you a YouTube video of the US Surgeon General showing how to make a mask to cover your mouth at home. There's just supplies you already have, like t-shirts and such. And then be mindful of what you touch. So whenever you are going out for essentials, you might wipe down your grocery cart, but you might not get everything that's on there. You might have missed a spot and then you touch your face, and we'll show a nice little video about cross-contamination later. But yeah, just be mindful of that. If you're touching the cart and different grocery items, don't touch your face or your phone or any of that stuff. Clean any shared surfaces in your home very thoroughly. So though you are sharing space, if somebody's going out to get groceries, they could potentially be bringing something home. So clean the bathroom surfaces and kitchen, all of that good stuff. You'll want to cover your mouth when you cough or sneeze. You should be doing that anyway, but especially in the midst of a pandemic, it's really important for you to be doing that. You're going to wash your hands often for 20 seconds or longer, and use hand sanitizer, and make sure to check that it is 60% alcohol or more. That allows it to do its job there. And then if you need help counting with, you can try singing the chorus to Old Town Road. TLC, No Scrubs, that might be a little dated for some of you guys. Or a newer song is The Hook from Migos Stir Fry. We'll give you some more songs at the end for the resources, and we'll go over those later. So staying healthy and getting rest is very important. important, even whenever there's not a pandemic. It's very important that you're getting sleep because that allows your body time to recharge. It's very important for your immune system, as is eating well and drinking lots of water. So think of the food that you're putting in your body is like the fuel that you put in a car. If you're not putting enough in or the right kind in, then you have the opportunity for a breakdown to occur and you won't be able to drive that car or use the body because you'll be fatigued from whatever you catch. Stay informed with trusted resources such as the World Health Organization or Centers for Disease Control and Prevention, and we'll give you some good resources at the end for those as well. So next, we're going to show you a nice little video. Hopefully we can get it to work here.
Gloves, you know, that's all fine and well. You absolutely can. But I want to remind you of a little thing called cross-contamination. So let's say I'm in my car, I'm at Meijer, I'm getting ready to go into the store, so I put my gloves on, all right? And then I grab my cell phone. For this purpose, this little piece of cardboard here is going to be my cell phone. So now I go into Meijer, walking around, I got my phone, maybe it's in my pocket, or maybe it's on the cart, okay? And I've grabbed my wipes and I've cleaned off my cart and I've cleaned everything off, but you know, I still have my gloves on. So here now I'm in Meijer, I'm getting my groceries and I reach for something and, you know, let's just say I reach for toilet paper, right? Well, if you can find any, get some toilet paper. Well, okay, take my toilet paper and I put it in my cart. And now if you can see, I have all these germs on my hands from my toilet paper, but it's in my cart, but it's on my gloves. That's fine, right? It's on my gloves. Well, you know, but now I'm walking along and my phone rings. So I've now touched my hands together a couple of times and I reach for my phone and I have a text message from my husband telling me to get more chicken. We need chicken tonight for dinner. So let me text him back. Okay, honey, I got it. I'll get us some chicken. Okay, so I put my phone back on my cart and I continue reaching for things, continue getting groceries. And you know, I just keep touching everything. Oh, my nose itches. Here, let me itch my nose. Okay, oh, now my phone's ringing. It's my mom. She needs me to get her something. Hi, hello, hi, Mom. What can I do for you? Oh, hi. Oh my goodness, look at all this bacteria. Oh, but now here, it's okay. It's totally fine because I'm wearing my gloves. I have my gloves on. I'm so safe in my gloves, right? And, you know, I'm done. I've paid. I'm at the grocery store. I'm all done. I've paid. My phone's back in my pocket. I get to my car. I reach for my car door handle. And then I'm all done with these gloves and I don't want these dirty gloves in my car, right? So what should I do with my gloves? Oh, let's see. You take them off appropriately and they belong in the trash can, people. Instead of putting them in the parking lot next to your vehicle, please put them in the trash. So now your gloves are off, your hands are clean, you're in your car, you're safe, right? But oh, your phone rings again. Oh no, let me pick up my phone here. Oh, hello. Look, this is called cross-contamination. There's no point in wearing gloves if you're not going to wash your hands every time you touch something. There's no point, friends.
Okay, so a nice little video for cross-contamination for you. So going back to the slides here, if I can get it to work. There we go. Okay, so now we're gonna go over symptoms and how those differ between COVID-19, the cold, and the flu. But first we're gonna discuss exposure a little bit here. So you're going to want to watch for symptoms if you are exposed to anyone COVID-19 positive or that they think that they're experiencing symptoms. Even if they think it's just a cold or a flu, you're going to want to monitor just to be safe because this is very contagious and it is easily spread. So symptoms typically appear 2 to 14 days after exposure. And then it's spread from person to person by respiratory droplets. So like I said, easily spread because if you're breathing, coughing, sneezing, or if you're not staying 6 feet away from people like you're supposed to, and heaven forbid they are a spit talker, and any of that gets on you, then obviously you're at risk for contracting it and spreading it as well. It can be spread by people who are asymptomatic, so just meaning that they're not showing any symptoms. And I'll just use an example here. So let's say that I am not staying at home like I'm supposed to, and I go to Lindsay's house and we're hanging out on the couch, and she has what she thinks is the cold, but it's actually COVID-19. And then I go home to my husband and my daughter and I'm interacting with them. I could potentially have COVID-19, but I'm not showing any symptoms because I just saw Lindsay that day. But then I'm spreading it to the people in my house, and then they could potentially be going to spread it to other people as well. So with that being said, though you can spread it whenever you're not showing symptoms, the people who are most contagious are obviously the people who are actively experiencing symptoms. So jumping into this symptoms here, so kind of a newer one that they're looking at is that people are experiencing a loss of taste and smell. So that's one of the common symptoms. A fever, which is a temperature of 100.4 degrees Fahrenheit or greater, or 38 degrees Celsius. And then a cough, which is typically dry. Doesn't mean that these are always going to be the case. It's going to range or vary between people. Shortness of breath and difficulty breathing is another hallmark symptom here. And then I don't know if y'all can see the change in color, but whenever the less bold color comes up, it just means that you may see those symptoms, but they're not as common as the ones that are in the bolded color. So fatigue is a symptom you might see, aches and pains, sore throat, and headaches. And then typically you're going to start feeling better if you have milder symptoms between 1 and 2 weeks after you first started experiencing symptoms. But people who have the more severe reactions to the virus, it can take 6 weeks or longer for them to start recovering from that. Now let's look at how cold symptoms differ from COVID-19. So you're going to have sneezing with the cold, that's pretty common. Runny or stuffy nose, sore throat, aches and pains. And then some of the less common symptoms you're going to see, but you could see them with the cold, as the fatigue, a cough, more mild cough here. And fever and headache, you can see them, but they're pretty rare for the cold. And for those, typically the recovery time is about 7 to 10 days whenever you will start feeling better. So you can kind of see there's a little bit of overlap, but there's also big differences between the cold and COVID-19. And then going over here, so let me move this because I can't see it. All right, so for the flu, you have a fever, so that one overlaps with COVID-19. And headache, fatigue, which you typically feel when you're sick anyway. Aches and pains is pretty common for the flu, and a cough, usually dry, so that one also overlaps with the COVID-19. Some less common symptoms here are the runny nose, sore throat, and diarrhea, typically seen in children, but people can still experience that when they have the flu. And the recovery time for the flu is roughly 5 to 7 days. Okay, I'm going to turn it over to Lindsay here.
Okay, so can you guys hear me? All right, so this, we're gonna do what to do if you think you have COVID-19 or if you actually do get diagnosed with having COVID-19. So the first thing is stay at home, and stay home unless you are advised by your doctor to leave to go to the hospital to seek medical care. Most people that get COVID-19 and have pretty mild symptoms, they're able to just stay at home and be treated. And you don't want to leave to go anywhere unless your doctor tells you need to, because you don't want to get anyone else sick. The second thing you want to do is, as soon as you start having symptoms, is contact your doctor and follow their recommendations. So if you get a fever, or you start feeling sick, or just think you might have it, call your doctor right away. With other diseases, like before, if you had the flu or anything before this, it's pretty common for us to walk into a minute clinic or make an appointment with our doctor. But since this is so contagious, contact them first and see how they want you to go about being treated and evaluated for having it. And then if your doctor does say that you need to come into their office or go to the hospital, The CDC recommends that you really try to avoid public transit, ride shares, anything like that, where you could get someone else infected on your way to get help, and that covering your face, so your nose and your mouth with like a face mask or bandana, something like that, to try to limit giving it to anyone else. And then if you are at home with COVID-19, stay away from others, especially non-essential guests. And this one's really tough because this even means other people in your house. If possible, you want to just totally isolate, kind of have your own sick room, especially if you live in a house with older people or people who may have like asthma, diabetes, things like that, because you just don't want to share that with your family members. Then you want to avoid sharing personal household items. So this is kind of the same. And again, this one can be tough. Like the CDC recommends that if you are sick and other people in your house aren't, that you have, stay in a separate room with a separate bathroom. I know like growing up, I shared a room with multiple siblings and we had one bathroom, so that can be tough, but as much as you can, try to not share bedding, towels, hairbrushes, even like the doorknobs, fridge doors, things like that. And if you do have to share things, just because of lack of, make sure that somebody wipes everything down with a household disinfectant that the CDC says can kill COVID-19 before someone who's not sick uses it. Then also cover your mouth or with any cough or sneezes, use a tissue or your elbow, and then put those tissues in a trash can that's lined, just so that you're not, when someone goes to empty the trash, you're not spreading more germs. Wash your hands often, like Kayla said. If Happy Birthday is getting old for you, there's plenty of newer songs that are also about 20 seconds. And have a caregiver thoroughly wash all your laundry, especially anything that may have been shared before you got sick, like pillows or blankets, things like that. The next one, monitor your symptoms and keep your doctor informed. If you get sick, likely your healthcare provider is going to give you some guidelines and talk to you about what symptoms to look for and when they want you to call them and keep checking up on you. But if anything changes, like you're getting worse, things like that, definitely let them know. And then if you're not sick and at home, it's not a bad time to see if you have like a working thermometer or things like that you have access to, just in case you do get sick and need to use it to communicate with your doctor. And then keep checking CDC, the health department, other reliable sources, their recommendations, because this is a new virus. So these are the current recommendations per the CDC, but they may be different next week or the week after that. And then lastly, follow your doctor and the health department's recommendations. Like I said, this is a new virus and it's changing all the time. So they're gonna have the most up-to-date information, and your doctor does want to try to treat you at home as much as possible, just so that the hospitals don't get overwhelmed. So if they tell you to go in, then listen to them and go in. I actually have a friend who has COVID-19 and she really, really, really did not want to go to the hospital and avoided it, even though her doctor was telling her that she needed to because she was having difficulty breathing, and she ended up having to go anyways, but just having to go through an ambulance. So not to scare you guys, but it is, if they tell you to go, it's serious and you should go in. And the next slide is we wanted to focus on mental health a little bit, because even if you are at home and your family's okay, it is a really tough time. So just recognizing that it's normal to have anxiety. It's a normal feeling, especially during something like this. It's a way that our body alerts us to threats so that we can protect ourselves. So just use that anxiety to try to make good choices, like wash your hands, stay at home and be safe. And just try to prevent it by controlling the amount of news you watch, things like that. You want to stay informed, but you don't want to overdo how much TV, things like that, like news coverage you're watching, to make your anxiety worse. And then take a look at your problems, your concerns, and you can kind of put them into two lists is another good tip. You can make a list of things that you can do something about and things you can't do something about. So things you can't do anything about are, being away from friends, not being able to go to events you want, being concerned that family members might get sick, things like that. But things you can do things about, well, this is kind of unfortunately probably a shorter list right now. Try to focus on that. So keeping yourself healthy, finding other ways to connect with family and friends, finding activities that, you know, take your mind off it, things like that. And then finding new ways to connect with your friends. Excuse me, this one, usually people that are in a younger age group are pretty good at this because they are very familiar with social media, but, you know, using like FaceTime, Hangouts, scheduling things with your friends so that you can still feel connected to them, even though you don't have contact with them. Also, just, you know, while you may be cooped up in the house with your family and getting annoyed with them, scheduling things to spend time with them, like a movie night or a game night, might help you feel a little less stressed out and a little more connected. And then, let's see, give yourself time and space to feel your feelings and kind of focus on your feelings. So unfortunately, with everything that's going on, a lot of us, especially younger people, are going to have to miss some kind of important events in their lives, like graduation, sports, hobbies that they were looking forward to. And it's okay to feel sad and disappointed about that. That is really disappointing. But, you know, you're not, you know, it may not be comforting, but you're not the only person having to go through that. And it is a time where you can focus on learning new things that maybe you never had time to do before. So I know on the internet, a lot of things are now free, like baking lessons, singing lessons, crafts. If there's anything you kind of were interested in learning, now's the time to look into it and see if it's something you could take your extra time to look into. And then be kind to yourself and others, because this is a really tough time for everyone and everyone's going to react differently and show their emotions differently. And so just being patient with people, being patient if they outwardly show their emotions differently than you do. And just, you know, it's kind of something we just have to get through together. And then lastly, if you really, you know, are feeling very overwhelmed or upset, find someone that you can talk to. So a lot of times we don't seek help because we feel like it makes us look weak. But, you know, finding someone who you can get advice from is, you know, a sign that you are self-aware that you need someone outside of yourself to help you improve your problems and make you better. So finding like a trusted adult, like a parent, pastor, teacher, something like that. And then the next slide. All right, so next we are going to do some fact or fiction, some kind of like common myths or rumors about COVID-19. So first is that COVID-19 only kills elderly people and those with underlying conditions, and that is fiction. So obviously older people are more at risk, and they make up a lot larger number of those that are dying from COVID-19. However, there are still plenty of young people that getting it. Actually, I think young people is the highest number of people getting it. And there, you know, are reasons that they can have more severe cases too. So it's not just an old person's disease or anything like that. And then NSAIDs, which is like Advil, Aleve, ibuprofen, they can make the virus worse. And that is also fiction. It currently is not totally known. The WHO, World Health Organization, and Dr. Fauci, who's in charge of the US infectious disease, they say that there's no reason to think this, but there are some rumors that NSAIDs can make it worse. They're not really founded in anything. So if check with your doctor. And of course, well, right now this is fiction. It's a new disease, so it's something we could find out next week, maybe what's true. So keep yourself informed. And then COVID-19 mutated out of people eating bats. And that is unsure. Well, they do think it came from like these big markets in China where there's a lot of meat out and possibly what's called pangolins, which in your free time, that's an animal to look up, or bats getting on these food. It's not for sure that it did come from bats. And then wearing gloves or a mask will keep you from getting COVID. And that is technically fiction. Obviously touching as little public surface as possible and protecting yourself is best. Just having a mask and gloves is not going to prevent you from getting it. There's actually a really good analogy, and I'll try not to mess it up, where it was the mayor of Los Angeles said how if you think of it like a football player walking through a door, they're going to walk through that door no matter what, they fit through it. But if a whole team of football players is coming through a doorway, that's kind of like what wearing a mask is. It's going to prevent less of that disease from getting to you, or if you're sick, getting out to the other people. And then since coronaviruses are the common cold, this can be cured with vitamin C and does not need a vaccine. And that is fiction. There were some positive results, I think in Italy, found where doctors were giving really high doses of vitamin C through an IV to patients, but did not cure them. And also taking vitamin C is not going to prevent you from getting the disease. It is a good idea to just have vitamin C in your diet to help your immune system anyways, but it won't prevent getting COVID-19. And then, is there one more on this one? Oh, pets can get COVID-19. That one is also unsure. So you probably heard there was like a dog and I think a tiger who tested positive. Right now, they don't think that animals actually get infected with it, or that they could give it to you, but still the CDC says if you have pets at home and you get sick, they recommend just having someone else care for that pet until you're better, just in case.
Yeah, I don't know what happened to the font here, but it drastically changed.
Yeah, it's a little light. All right, you can lose your ability to taste or smell when you're sick with COVID-19. There's one that Kayla kind of talked about before, and that is a fact. So it's kind of a unique symptom. Usually things like the cold and flu don't cause you to lose your loss of taste or smell. So far, people that have lost it when they're sick get it back when they're healthy, but if it is a symptom. And then the virus will go away in the summer when it's hot out. And that's maybe. They do think that warmer weather is less of a good environment for these viruses to infect people, but it's not sure, although it is a positive about it being Texas, because if it's true, we will definitely find out and benefit from it. And then COVID-19 will return every year like the flu. And that is also unknown. I think experts kind of think it is something that we could deal with every year. We just don't know yet. And then this pandemic may last into the summer or longer. And unfortunately, that is also unknown. There was a model of with like the shelter at place done at UT, trying to see kind of when we'd hit that peak, and they believe that it'll be around June right now, I guess is what experts are saying. And that's if everyone stays home and follows social distancing, then we should hopefully, it'll end, I guess, kind of middle of summer. And then doctors are having success in treating patients with malaria medications. And that is a fact. So hydroxychloroquine, or Plaquenil is another name for it, is a medication that's also used for malaria and has been somewhat successful in treating COVID-19 patients. So the FDA gave it kind of special status to be used for COVID-19. It's kind of an older medication, so it does require some careful monitoring by doctors. And then just an interesting thing about it is while it is successful now and hopefully stays that way, they also thought it would be successful in treating the flu like 10, 15 years ago, and it started successful and then didn't stay successful. So it's good for now, but hopefully there'll be better medications or vaccine in the near future. And then the flu from COVID-19. And this is fiction because they are two different viruses. However, it is a good idea to get your flu shot anyways, because no one wants the flu, and having both at the same time would probably be pretty miserable. Plus, the flu does kill a lot of people every year. It's less contagious than COVID-19, but it is also something that's really dangerous for older people and people who are sick. And then the next slide. So we got a few questions from you guys ahead of time, so we'll go through those. First being, how do you self-quarantine at home when you're sick? So we kind of went over that earlier and in the previous slide, but the best thing to do is just stay away from people. Don't share surfaces as much as possible, and check back with what your doctor, the health department, the CDC say, because some of those things change all the time. And then the next one, what to do when you're too sick to clean and cook. So that is tough. Hopefully you have somebody that can help you out. You know, at least leave food for you at your doorstep so that you can have like a friend give you like a non-contact drop off of groceries. If you're able to just stay away from everyone who's healthy, then you don't have to clean till you're better. But if there are healthy people around you where you do have to share things, then ask them to help you out and clean anything that you could contaminate. And for people who are immunocompromised, so have a weakened immune system, like a lot of people with cancer or other diseases, what precautions can you take to sure if you, whoever asked that meant it as if you are actually immunocompromised or if you're around people who are immunocompromised, but kind of same both for everything is just stay away from everyone, act like everyone who around you is sick. So social distancing, eat healthy, lots of fruits and veggies, get a lot of sleep, wash your hands often, try not to go out very much except for, you know, the necessities. And when you do so, practice social distancing. If you are immunocompromised and know that, there's a lot of various reasons that people are immunocompromised. So that's when to check with your doctor. I know, like I have asthma and my asthma doctor contacted me to make sure I had all the inhalers I would need and stuff in case I got sick. So check with your doctor, but otherwise just stay as healthy as possible and stay social distance, stay away from people. And then if you test positive for COVID-19 and are sent home, mild, moderate symptoms, what medications are doctor prescribing? So this, I think, changes a lot, probably case by case. I think what I've heard is most mild cases don't really require any medications, more like symptom management. So like Tylenol or like a cough medicine. Since there's not a cure, there's not like an antiviral they can give. Sometimes they give antibiotics, even though antibiotics don't work on viruses, but maybe to help with inflammation or if you got a secondary infection on top of having COVID-19. Inhalers, I know a lot of people are being given like inhalers or nebulizer treatments when they're at home, especially those who may have had asthma before and now have COVID-19 on top of that. And then Plaquenil, the malaria medications are being used some. But most people that are pretty healthy otherwise and stay home, I think are just, for the most part, symptom management and kind of writing it out as best they can at home. And then what treatments, medicines are doctors providing to patients with COVID-19 that are hospitalized? So this one, I don't have a great answer for you. I mean, it varies, obviously, the malaria drugs for a lot of people. A lot of people who are hospitalized are on some type of like oxygen to help them breathe, or even like a ventilator to breathe for them. I think they're kind of trying different things like steroids, IVs to, if they're like really dehydrated, things like that. And a lot of times people are hospitalized, it's because they have like an pneumonia or another infection on top of their COVID-19. So treating that, obviously with maybe like antibiotics or whatever, would treat that particular disease. And what symptoms would trigger someone to get tested for COVID-19? That changes all the time. I think right now there's more tests available, really probably just a fever or being in contact with someone who has COVID-19. I know before there was a lot of criteria, like have you traveled, things like that. But right now I think it's changing daily, just more and more people are able to get tested as more tests are available. If you think about if you've ever been sick in the past and gone to the doctor during flu season, you always get tested for the flu. So I think that's where they're trying to get with COVID-19. So hopefully now it's just that you have a fever and you don't feel good. And how close are we to finding a cure for the virus and also a cure for cancer? That one's tough. Kayla kind of touched on it earlier, that these things, like there may be a medicine or drug, vaccine that shows a lot of promise, but it can take 10 to 15 years to be out in the general public, just because they have to make sure that it not only does it work, but it's safe. And, you know, say they find out there's a really bad side effect, well, that kind of sets that cure, vaccine, et cetera, back a few steps, because they need to either, you know, start over or make changes before they get back to doing what's called clinical trials, where they basically use it on, test it on people who are aware they're being tested and signed up for the test. Cancer is definitely different than COVID-19 because it's for the most part not communicable. It's something that is just, you know, your cells mutate and start replicating themselves. There are a couple viruses that could lead to cancer down the road, but for the most part, cancer, you can't spread it at all. And there's also very different kinds of, you know, you think of like breast cancer, skin cancer, lung cancer. With cancer, pretty much all the time we're getting closer and closer. It's just how long until for each particular cancer is there something that works and is safe. So for those of us just out in public, it seems like that's taking a really long time. But, you know, if you were in the research field, you'd realize it's probably getting closer every day. So that one, there's places like NIH or things like that, if you really want to research it, to look at all the clinical trials that are going on. And when you look at those, you realize like, wow, we really are getting a lot closer to finding cures for these things. But, you know, day to day, we don't hear about them because they're not out on the market yet. And then as far as finding a cure for the virus, I guess kind of the same, except hopefully just a lot faster, because a lot of doctors and researchers are now working together because it has such an effect and is such a contagious virus that they're trying to find something a lot sooner. So probably because of the huge effect it has worldwide, we'll find something sooner, whether it's like a antiviral medication or a vaccine, hopefully in the next couple years, but that will still take some time.
All right, so then we'll just wrap it up with resources here. So for the sake of time, I'll go through this relatively quickly, and then you guys can look at the various links on your own. But the reason why I picked the first one is because I thought it was great for giving directions for checking temperature, washing your hands, physical distancing, and it also provides you the phone number to your local health department. So you'll see it varies by state. There's a big chart, but just go down, it's in alphabetical order. And then the next link that I have for you, it's updates on COVID-19 per the World Health Organization. So they update that daily. So if you want to see how things are evolving, you can look there. As Lindsay already recommended, don't be checking it every minute of every day. It's very important for your mental health, for you to kind of just peek to see if there's anything new evolved, but don't spend too much time there, right? And then the next one is Mythbusters for the WHO. So we went over some of that with our fact and fiction game, but there's some other things there, like UV lamps and stuff for disinfecting your phone, which they discredit it and say that it's a myth. So don't run to Amazon and try to get one of those because it's not helpful. When and how to use a mask for per the World Health Organization. And then the next one is updates per CDC. So it might be some overlap for the World Health Organization one, but you can see if there's any differences there. And then the next link is different songs to use to wash your hands. So it might be a good idea to print that out and post it on your mirror in your bathroom, and you can kind of rotate through the songs that you like, or even go online and research some other songs for 20 seconds worth of lyrics to ensure that you wash your hands for at least 20 seconds. The next one is how to protect yourself and others, and it's a disinfectant guide. It also has various links that are great on there, but that part in particular I wanted to add because Lindsay talks about using recommendations for disinfectants that actually kill the virus, because maybe not all of them are helpful. So these are the ones that the CDC actually recommends. And then lastly, a little video. It's a YouTube video of the US Surgeon General demonstrating how to make a mask with just stuff that you have at home. So it might be a fun little competition if you're competitive, like I am, to go on Zoom or FaceTime with your friends and see who can make the best face mask with the stuff that you have in your home. And then that concludes our presentation, and we're already over time, but open it up for any questions that you might have.
Kayla and Lindsay, thank you so much for that informative presentation, and thank you for answering the questions that were sent to us in advance. Out of respect for everyone's time, I do want to say that the presentation is technically over, but I know there are some people that joined us, and so I also want to, if there's a question or two, we may have time to answer one or two questions from the people that joined us today.